Alright, so today we're going to be diving into brucellosis, a zoonotic infection caused by the Brucella bacteria. We'll cover its etiology, pathophysiology, clinical features, diagnostics, and treatment. Let's get started. Brucellosis is caused by gram-negative coccobacilli of the genus Brucella. The most common species include B. abortus, B. melitensis, B. canis, and B. suis. These bacteria are facultative intracellular pathogens, meaning they can survive both inside and outside cells. The primary routes of transmission include direct contact with infected animals or ingestion of contaminated animal products like unpasteurized milk and cheese. Brucella can enter the body through skin lesions, mucous membranes, or inhalation. People working in slaughterhouses, veterinarians, and farmers are at higher risk due to their close contact with animals. Additionally, travelers to endemic areas should be cautious about consuming unpasteurized dairy products. Once inside the body, Brucella is ingested by phagocytes like macrophages and neutrophils. However, Brucella has several virulence factors that allow it to avoid destruction. It uses a type 4 secretion system to dampen the immune response and non-endotoxic lipopolysaccharide to inhibit phagosome-lysosome fusion. The bacteria replicate within the phagosome, avoiding detection by the host immune system. This intracellular lifestyle helps Brucella evade the immune response, leading to persistent infection. Brucella's ability to manipulate the host immune system response is key to its pathogenesis. By preventing the fusion of phagosomes and lysosomes, Brucella creates a niche where it can replicate safely. Brucellosis typically presents with nonspecific flu-like symptoms, including fever, sweating, headache, myalgia, arthralgia, weight loss, and fatigue. A characteristic feature is undulant fever, which rises and falls like a wave. On physical examinations, patients may have hepatomegaly, splenomegaly, and lymphadenopathy. The severity of the disease can vary depending on the Brucella species involved. B. melitensis is often associated with more severe and acute forms of the disease. Chronic brucellosis can lead to complications such as osteoarticular movement, including sacroiliitis and spondylitis, as well as endocarditis, which is a serious condition requiring prompt treatment. Brucellosis can also affect the central nervous system, leading to neurobrucellosis, which manifests such as meningoencephalitis or meningitis. This complication is more common in severe or prolonged cases. Diagnosis of brucellosis is confirmed by isolating the bacteria from blood or bone marrow cultures. However, Brucella is slow-growing, so cultures can take several weeks. Modern automated systems like the BACTEC system can isolate Brucella faster. Serological tests, such as the serum agglutination test, ELISA, and complement fixation test are also used to detect Brucella antibodies. Initial infections raises IgM antibodies, followed by IgG antibodies several weeks later. Molecular methods like PCR are becoming increasingly important for the rapid diagnosis of brucellosis. PCR can detect Brucella DNA in clinical specimens, providing a quicker diagnosis than traditional culture methods. Brucellosis is treated with a combination of antibiotics, typically doxycycline and rifampin, for a minimum of 6 weeks to prevent relapse. In severe cases, additional antibiotics such as streptomycin or gentamicin may also be used. During pregnancy, tetracyclines like doxycycline are contraindicated due to potential harm to the fetus. Instead, a combination of rifampin and TMP-SMX is recommended. In cases of chronic brucellosis or complications like endocarditis, a more aggressive treatment regimen may be necessary. Surgery may be required to address severe complications, such as abscesses or damaged heart valves. Prevention of brucellosis involves controlling the infection in animals through vaccination and testing. Humans should avoid consuming unpasteurized dairy products and take precautions when handling animals or animal products. If left untreated, brucellosis can lead to complications such as osteomyelitis, endocarditis, meningitis, and liver abscesses. Early diagnosis and appropriate treatment are crucial for a favorable prognosis. Chronic brucellosis can lead to osteoarticular complications, particularly affecting the spine and joints. Patients may experience chronic back pain due to spondylitis or sacroiliitis. These conditions require long-term antibiotic therapy and sometimes surgical intervention. Another severe complication is endocarditis, which affects the heart valves and can be life-threatening. Endocarditis caused by Brucella species is often resistant to standard treatments and may require a combination of antibiotics and surgical valve replacement. Neurobrucellosis is a rare but serious complication involving the central nervous system. Symptoms include headaches, seizures, and neurological deficits. This condition requires an extended course of antibiotics and close monitoring. To illustrate the impact of brucellosis, let's look at a few case studies. For instance, a 35-year-old farmer presented with prolonged fever, night sweats, and back pain. Blood cultures confirmed brucellosis, and treatment with doxycycline and rifampin led to a full recovery after 8 weeks. Another case involved a veterinarian who contracted brucellosis after assisting with a difficult calving. Despite wearing protective gear, the veterinarian was exposed to Brucella abortus. Early diagnosis and treatment with antibiotics prevented severe complications. In summary, brucellosis is a serious zoonotic infection that can lead to various complications if not treated promptly. Understanding the etiology, pathophysiology, clinical features, diagnostics, and treatment options is crucial for healthcare professionals managing this disease. Thank you for watching, and if you found this video helpful, please like, share, and follow for more. Leave a comment if you have any questions. Thank you.